Good afternoon, everyone. Welcome to our second Community Leaders Update on the COVID-19 virus pandemic. I'm Mike Wilder, and I'm the Emergency Management Director for Danville and Boyle County. We have with us present Judge Executive Howard Hunt, Mayor Mike Perros, and we've also asked Brent Blevins, our Boyle County Health Director, to join us today as well. Brent will give us an update and be here to field questions. So please use the number 859-936-6865. Again, that's 859-936-6865 to call with your questions or comments to either Judge Hunt, Mayor Perros, or Brent. This event, as usual, is being streamed live on YouTube. Hometown Radio is covering the event, as well as the Advocate Messenger. To access the live streaming, please go to boyleky.com, then click on the Boyle County Media channel, which is located in the upper right-hand corner of that page. One update that I might pass along that I got this morning fairly early is that the Eford McDowell Hospital has set up a drive-through testing site at 1451 Lebanon Road, which is the former daycare center, which is now the walk-in clinic for McDowell Hospital, as well as Dr. Don Hamner's office. A couple of things they wanted me to relate to the public should they consider coming out there is, please first call the hotline that goes directly in to the building there at the testing center. It's 859-936-8530. Again, that's 859-936-8530. They will talk with you and explain to you the procedures, and should you want to come out and be tested, they'll be there to do it. Again, they did say if you did not call and come out anyway, they could take your information there and possibly test you as well. But it would make it easier on everybody concerned if you would call the hotline number first. We continue to be in contact with all of our partners and stakeholders. We have numerous conference calls each week with Boyle County, the Boyle County officials, as well as Kentucky Emergency Management, the Governor's Office, and the Department of Public Health. So just to let the public know, we are in close contact with everybody that we need to be in contact with. I want to now turn it over to Judge Howard Hunt, who will make some opening comments.
Well, it's good to be with you again today, and I hope as people see this, they will come more and more each Monday and Thursday afternoon at 3:30, and the phone number is there where you can see it to call in with your questions and comments, and we've already started getting those. The one thing that I feel strongly about this opportunity to reach out to the public here in Boyle County is to provide you with the latest information that we are aware of that can help you be better out there in Boyle County, better protected, and more aware of what's going on around the community and around the state and the nation. One thing I want to talk about real quick is I want to read you some information that Congressman Brent sent me, and we're going to put up on our website here at Boyle County, boyleky.com, and under the coronavirus magenta tab. But it's real important for small business, and I'm going to read it just very briefly. It's called the Small Business Paycheck Protection Program. The Paycheck Protection Program provides small businesses with funds to pay up to 8 weeks of payroll costs, including benefits, and funds can also be used to pay interest on mortgages, rents, and utilities. Funds are provided in the form of loans that will be fully forgiven when used for payroll costs, interest on mortgages, rent, and utilities. Due to the likely high subscription, at least 75% of the forgiven amount must be used for payroll. Must keep employees on the payroll or rehire quickly. Forgiveness is based on the employer maintaining or quickly rehiring employees and maintaining their salary levels. Forgiveness will be reduced in full-time headcount declines, if full-time headcount declines, or if salaries and wages decrease. All small businesses are eligible. Businesses with 500 or fewer employees, including nonprofits, veterans organizations, tribal concerns, self-employed individuals, sole proprietors, independent contractors are eligible. Businesses with more than 500 employees are eligible in certain industries. When to apply? Starting April 3rd, 2020, small businesses and sole proprietors can apply, and starting April 10th, 2020, independent contractors and self-employed individuals can apply. We encourage you to apply quickly as you can because there is a funding cap. In other words, almost first come, first serve. We will put on our website this information about the Small Business Paycheck Protection Program and links where you can, and sample forms you can download and fill out and talk to your financial lender, whoever that may be, about the Paycheck Protection Program. And we're very hopeful this will help our small businesses bridge to better times. Thank you.
Mayor Perros?
Thank you, sir. Thank you, Judge. Good information. A couple of other pieces of information that Bluegrass Community Action Partnership has announced a very nice service for anybody 60 and over or who is disabled. They are offering to shop for you, essentially. Number one, you make your list. Two, you call your list into their office, which is, phone number is 800-456-6588. 800-456-6588. Number three, they shop your list for you. Number four, they will deliver your goods to you, and the delivery charge is free.
Wow.
Number five, you do need to pay for the merchandise, so you want to make your check payable to BGCAP. BGCAP. Good information to know. Secondly, I would, whether you go on boyleky.com or danvilleky.gov, there's excellent up-to-date information on our situation with this thing called coronavirus. I want to thank our new city manager, David Milliron, for keeping us up to date. It's a chronology if you want to go through that. Let me find this for you because we still have a lot of people that are, I think, feeling like this 6-foot thing, separation or quarantine in place doesn't apply to them. Let me give you an interesting perspective I just ran across. Listen to me carefully. America has already lost more citizens to the coronavirus in 3 months than it has in either of the Iraq or Afghanistan wars that lasted for almost 2 decades. You think about that one. And if that doesn't give you some perspective on what we're dealing with here, if that doesn't make you realize that yes, we need to quarantine in place as much as possible, yes, we need to maintain 6 feet between us, if that doesn't convince you of something, I'm not sure I know what will. I do know that we are experiencing difficulty with our larger retailers as consumers continue to shop them as if there was no coronavirus at all. I would say it's probably safe that we will take some action to limit that. Don't mean to cause any inconvenience, but we've got a problem and we need to deal with it, and we intend to do that. So I believe that's all I have. Thank you.
Thank you.
Thank you, Mayor. One of the things that people have to understand is, this is going to be a long, drawn-out thing, and it's going to take a long time to get over. We haven't even finished the peak. We're not even near the peak yet. So it's far from being over. And if you just buckle down and do the things that the health department asked us to do and do it for a limited amount of time, I think we're gonna be fine. But again, it's like the mayor said, you know, if it continues as it is down the road, I mean, there has to be some action taken, because we wouldn't be good stewards of the taxpayers' money and their beliefs if we didn't do something about it. So, Brent, would you like to make some comments?
Sure. I think first, we're fortunate in Boyle County and Danville. We've got great people here. We've got great agencies, great emergency preparedness agencies. Our hospital is great. EMS, we're fortunate. So, you know, we've got to take that every day as a blessing, truly as a blessing, because these people are prepared, and it just helps us as we move forward. Definitely appreciate all the people sitting around this table and what they're doing every day. It just makes a difference. Okay, let's talk about some facts. Everybody's probably aware now that every day about 4 p.m. I put out a post. And what my intention with that is to update on number of positive cases we've had, if we've had no positive cases, those type of things. Today, and you will see this at 4, it'll come out that we have 3 new cases for a total of 7 here in Boyle County. All 3 of those, we received the results late last night, and early this morning already started working the contact list on those, and everybody has been contacted as of pretty early this morning by 11 or so today. So that leads me to another little piece to help you understand how this works. Because we get a lot of questions about people wanting to know, what happens if somebody's positive? How does that work in the community? And here's how it is. Once we receive that information and we receive the person's name, phone number, we give them a call. And what we do is we start putting together a line list of all the people that have been in close contact with that person, how long that's been over a certain period of time. And as we build that list, then we start calling the rest of the people on that list. And then we make a determination. Does somebody on that list also need to be quarantined for a period of time? Or was it literally just a passing somewhere and there's no need to be quarantined? So that just gives you a rough idea of how that works. This morning, just to give you an idea on each case, it probably took us an hour to get through those lists, call everyone, and see what we needed to do. Now, what happens tomorrow? Certain people on that list we will be in contact with for 14 days. And here's what we're wanting to know. Are you having any signs or symptoms that would indicate that maybe you had been exposed enough that you had contacted the COVID-19 virus, or is there something else going on with you that needs to be checked out? And we do that for 14 days. So that's how we get through that list. Most of the people we're contacting for 14 days is not a big amount of people per case, but there are some. So hopefully that helps you to understand how that works on the cases, what we're looking at, and to have a little knowledge on that. Now, we'll also get a lot of questions on, oh man, we had 3 new cases today, and we did. We don't want anybody to be sick. We don't want anybody to have it. But we knew going into this that we would have a time period where we're going to have more cases. And we are in that time period right now. So all the preparation that's been done for the last month or 2 was built up for right now, because that's what we're starting to look at. Along with that, we have increased testing. As Mike was talking about the testing that's going on out on Lebanon Road, there's also more commercial labs that are now doing the testing, so more local doctors are able to do that. The benefit in that is that the more people that are tested, the earlier we can potentially find people who have the virus, isolate it or quarantine it right then, and then quarantine other people around them. And that helps to stop the spread. So that's our goal with the testing and what we're looking at with that. Keep in mind that, as I said before, that we are in this time period right now. We're going to see more cases. And as Mike said earlier, we are right now climbing up that peak and seeing how that's going to work. The great thing is eventually we will get to the top of that peak, and hopefully, because we have a great healthcare system here, we will have a very reduced amount of people that we can in this area as far as being sick or something even worse. And then we'll start down the other side. And that's what we're looking forward to. But you will hear me say this a lot. Just because it seems like we're going down the other side, we will still need to be diligent about social distancing, washing our hands, keeping our hands off our face. because that'll be important for a while. Okay, so now let's talk a little bit about businesses, because you heard the mayor talk about the businesses and things they're looking at, and all those are great, great comments about that. Keep in mind, if you are a business that is open, doesn't matter the size or where you are in Boyle County, it is your responsibility to ensure that your people and that the people that are working and the people coming in your business are able to do social distancing. Also, it's your responsibility to make sure they either have the ability to wash their hands with soap and water or hand sanitizer. Those are requirements that you have to do. And those are requirements that we'll have for a while. We're trying to put more and more pictures of businesses and people that are doing appropriate social distancing up on the internet so people can see what that looks like. We had a great one over the weekend, which just happened to be driving by southern states. They were giving out minnows or something, and everybody in the parking lot, I said nothing, were a minimum 6 feet, if not more, apart. That's what we need. We need people doing that on their own without somebody having to tell them. I know a lot of our stores are putting signs on the floors, information like that to help people remember that. And it's also good to help kids remember that, hey, we need to stand apart from each other. A little bit about the testing and how that works. As this has been an ongoing situation, and it's taken a little while for the commercial labs to start doing the testing, there has been a delay sometimes in us getting the testing results. And I do get that question quite a bit of, why, Brent, did you put out today that we have 4 cases and the governor said we had 2? Well, here's what's going on with that. We get that information as soon as it comes into the local labs, to the local doctors, and we put that out as soon as we can. However, sometimes there's a delay in that lab actually putting that information into the correct system so that the state can see that. So we send that information up as soon as we can, but with the amount or the volume of information the state is juggling right now, sometimes there's a little delay in that. That is getting better. And I do think that's getting faster, and we'll get that cleared up. But hopefully that helps you understand why sometimes there's a delay. Okay, I know that's a lot. I know I said a lot right there. Definitely will answer some questions, but I definitely want everybody to understand this. Social distancing, washing your hands, keeping your hands off your face, and stay home if you're sick are the keys to what we're doing right now. It's what we've been doing for a while. It's what we'll do for a little while longer. But right now, as we're climbing that peak with the surge of cases, it's important. And it'll continue to be important, but right now, let's focus on that. Okay, questions?
I got one comment I'd like to make, just to kind of give you some information. While Brent gets ready to respond to our first question that we received, is that as of April 1st, yesterday, at 5 p.m. Eastern Time, Kentucky had tested 7,900 people, and this is off the covid19.ky.gov site. Positives across the state of Commonwealth was 680, and deaths were 20 as of 5 p.m. yesterday. I think to put in perspective, with the large population counties of Fayette, Northern Kentucky, those cities in West Kentucky, Bowling Green, Owensboro, Louisville, Jefferson County, that for 120 counties, if you divide that into 680, is roughly 5 positive cases per county. Now, there are larger concentration of hotspots in the larger populated areas. We all know that. But the more we can be compliant with the guidelines and the rules of engagement that Mr. Blevins just talked about, the quicker this would possibly be over for us, because the virus will go away if it doesn't have something to attach to contaminate somebody. And that's why we need to be more cautious in compliant and adhere to all these rules. And I heard one doctor from New York say one of the biggest things that even if you touch it, if you don't touch your face, you're probably not going to contaminate yourself if you keep your hands clean before you go touching your face. So anytime you touch something that is kind of somewhat foreign to you, as quick as you can, get to where you can use some sanitizer and some wipes and clean your hands. I think that will help a lot, because I know it's hard not to rub your face or touch your face. We don't want to do that if we can help from it. Brent?
Great comments. I agree exactly with what you said there. Okay, a question. Should someone travel from Louisville to Boyle County? They were working up there in healthcare. All right, let's talk about, that's a great question. Let's talk a little bit about travel. First of all, if you don't need to travel unless it's for a business, you have to work, or something similar to that, stay where you are. Just stay where you are for a couple of weeks, and let's see where we are then. I know a lot of people, they haven't seen grandkids, or they haven't seen their kids, and some things like that for a while, and I get it. I know social distancing is great, but it's, using social media to see each other is great, but it's not the same as being in person, and I get that. My kids are in South Carolina, miss them every day, but eventually I'll see them again. But if you don't have to travel, stay where you are. Just don't do it. If you absolutely have to work and have to travel, by all means, to keep your job and your company still open because it's essential, travel. But go straight there, go straight back home. Don't make any side, ventures, anything like that. If you need to stop at the store, go straight in, come straight out. Definitely support our restaurants and those businesses, though. If you can, drive through, get that on your way, and go back home. But just don't travel. If there's not a need, just don't do it. And you'll hear me stress that a lot. The people that I have talked to that are coming in, we do have some that'll come in from some other states, and I know the governor is really trying to restrict that. They're quarantined for 14 days. And I've had people today ask me, hey, I'm coming from another county, I'm gonna be there for a while, and what do I tell them right up front? Quarantine for 14 days. That's what it'll be when you get here. And that's just good, safe practice for all of us.
Is there any update from the Wilderness Trail Distillery? What's going on with those folks? They still producing product? And
talk about a community resource that has stepped up. Oh my, Shane Baker and Pat and those guys out there, tremendous. And they produced, we've already had 2 loads from them, and most everybody knows, but if you don't, they did that and donated that to the community. And we started giving that to the hospital, EMS, fire, police, all those people involved in our healthcare, long-term care, because they needed that hand sanitizer. And Wilderness Trail really stepped up to do that. They're continuing to do that, and it depends on how their shipments run or their production runs, and they'll get that to us, and we'll start that process immediately again. Usually that's on a weekend, and we start distributing right then to who needs it, and to get that out. But true example of the community.
They did start putting some stuff online for purchase by the public. Is that still?
I don't think so right now.
Okay.
I think what they're doing right now is they are producing for us to use as needed for our healthcare type people. It's not to say that they won't do that again, but I don't think they're doing that this week.
Let me share a couple of statistics that have just kind of come through. You may already know about them, but officially we have just recorded the 1 millionth case globally. And of that 1,230,000 have been in the United States. Wow. The projected number of fatalities in the United States is right at 250,000 people. And that's with all the preparatory work that we're doing. So again, I know I'm beating a same drum. Stay at home, limit your contact, 6 feet all the way around best you can. Because that's really the only way that we're gonna keep these numbers down.
Well, and Mayor, to add to that, I think it's really important that as many people as possible take advantage of the good graces that our retailers in this community are doing, like Walmart and Kroger and others. They'll shop your list of goods that you want in the store and bring it out to you, much like that program you addressed earlier. and bring them out to you, and you just run your card or write the check, whatever, to them. But you don't have to go in to shop for your groceries at Kroger or Walmart. So I just, I think it's something that we need to take more advantage of right now to keep the volume of people down in these large box stores and minimize that exposure. And by any given imagination, you're going to be much safer being in your car to receive your grocery list and your necessities than you are going through the aisleways of these big stores. So think about that.
Good points, great points about that. And you jogged my memory on something else I want to talk about. The weather today is starting to get a little nicer. It's 60-some degrees, the sun is out, it feels good. It's good for all of us to be out in the sun some and just enjoy that sunlight. It seems like it's been a long winter. It has been. But here, just keep in mind the same guidelines that everybody around this table has talked about. Don't be in a group. Don't be in a mass group. Don't be in a group. Enjoy your yard. Keep that 6 feet distance away, if you've got neighbors. I've seen some real creative things on social media where people sit in their yard and they're probably 20 feet away and they're talking to their neighbor just across the fence. And it's okay to do that. But don't take that too far. Don't be in a group. Don't be playing a 5-on-5 pickup basketball game where you're on top of each other, that kind of thing. Because then that's when we start having issues. So, but enjoy that sunshine. It is nice out there. And that helps. It helps all of our moods probably.
Well, the vitamin D that you get from the sun is great for you.
That is great stuff.
And the virus doesn't like sunshine.
No.
That's right. So, okay, other questions or?
Just, I always like to make mention, and I'm reminded by some of our first responders to always do this. Please keep our responders, our medical community, the people that are on these front lines, in your thoughts and prayers, because you cannot imagine the job that they're doing unless you've actually been down there and seen some of the things they do. It's unbelievable. And all you have to do is turn the television on and you get New York City and you get Chicago and you get those people up there and just how they're suffering, and it's amazing. We're just so fortunate here to have what we got, and keep them in your thoughts and prayers. If you see them out somewhere, holler at them. Thank them for what they're doing.
Absolutely.
Thank them for what they're doing.
These people it's like a war. This invisible enemy has been equated to like a war. And our healthcare providers and our first responders are on the front line, in the trenches, troops on this daily. And if some of you watch TV, you'll see large audiences of people in high-rise apartments in Europe and New York and Chicago giving police patrols and firefighters as they see them applause and thank you and everything. So just pray for our first responders and healthcare providers, because they're putting their lives on the line every day when they go to work. So give them a big thank you for that. Thank you.
Mayor, any other comments?
No, sir. Just Bluegrass Community Action Partnership. It's free. Make your list. Give them a call. They'll shop it. They'll bring it to you. It's free. I can't think of a better way to get it done and limit your exposure.
Thank you. Just remember to be prepared, not scared.
Brent, any final words?
I do. You jogged my memory, Judge.
Feel like you're getting old.
I know it. I am. It's just what happens. Something to keep in mind about our health care too is remember those 3 guidelines. If you're not sick and you wouldn't normally go to the ER or the doctor, don't go. If you're feeling a little sick but you still wouldn't go to the doctor or the ER, don't go. If you think you might need the ER and truly need it, give them a call if you can, or how that normally goes, and definitely use them. But keep those guys as few people down there as we can for the people who truly run through this virus and need it. And that's just kind of some key guidelines we've been pushing for a while. But other than that, thank you guys. I appreciate everybody around this table and all the people out there serving, all these emergency responders and our hospital and doctor people. True heroes for what we're doing.
Brent, I don't think we can thank you enough. Any of the 3 of us, you're the point man on this game, and I'm telling you, I'm glad to be on your team, brother. I'm glad to be on your team. So
thank you.
you're doing a good job.
The Tom Brady of the health.
There you go.
That's
There you
scary.
go. I think without any other ado, if there's no more questions, I think we'll say goodbye again today and see you Monday afternoon at 3:30.
Yes, sir.